Hi, everybody. Thank you so much for being with us today. Hello, my name is Carolyn Sheridan. I am NORD's Associate Director of State Policy. And thank you once again for joining us for our now sixth annual Rare Disease Advisory Council Stakeholder Webinar. Today, we are celebrating 5 years of Project RDAC, and we have a few guests with us today. The first guest is going to be giving our welcome, and that is our very own CEO, Pam Gavin. I will kick it to you, Pam.
Thank you, Carolyn. Hi, everybody. I hope you're having a great day. It's wonderful to be with you. Thanks for tuning in with us. Um, Welcome to our sixth annual RDAC Stakeholder Webinar. This year marks a very special milestone. It's our 5-year anniversary of Project RDAC. 5 years ago, there were just 8 councils around the country that existed at the time, and we had several advocates reaching out to ask NORD, how do we start one in my state? How do we get started? And so with that, we thought we should invest in this. We should help make this happen. So that's really how Project RDAC got started, because we really believe that bringing rare disease stakeholders into a formal advisory-like structure would help strengthen state policy work for people living with rare diseases in across the country. So we've gone from those 8 to 32 nationwide, and the model legislation created has really directly contributed to the generation of 25 additional councils. Um, we now also have an in-person collaboration forum for the RDACs that we host in October, co-joined with NORD's annual Breakthrough Summit. Of course, we have staff that we have dedicated to supporting and engaging with the RDACs, uh, and the critical structure that you all formulate together. And an interesting key fact is that 80% of Americans now live in states with advisory councils. So that's pretty solid representation. So what we want to talk about today is, we really want to show the effect of many things, but of course, let's start with the effect of what RDACs has meant. Look at the measurable evidence that the councils have shown to improve state policy outcomes for people living with rare diseases, because of course, that's really why we're doing the work that we're doing. You'll hear from lawmakers. Carolyn mentioned we have some lovely guests, these lawmakers who champion new RDACs in 2025, and you'll see real examples of councils creating change in their states. Looking ahead, however, we're expanding our scope. For 5 years, we focused on establishment, helping councils get creative. And we're not going to do away with that, but we are expanding because now we want to do the groundwork to help these incredible RDACs survive and thrive, so that they can be in existence for the next 5 years and beyond and continue to show market improvement on outcomes for people living with rare diseases in their states. And, that's what the data is all about, providing models that work so we can make it even stronger, learn from areas to improve, and put the gas pedals on areas that are strong and doing well. So before we dive into the numbers and celebrate our wins, let's make sure we're all on the same page about what we're talking about. So I'm going to turn it back over to Carolyn to take it away. Thank you.
Awesome. Thank you so much, Pam, for kicking us off today and for your leadership as well. Your trust and support in me and all of us here at NORD, it really means a lot to us and it empowers us to do our best work every single day. So thank you so much for that. Diving in here, I thought you would all really love to see some of this. So earlier this year, I asked my ignored colleagues here internally, people across every department, from finance to education, patient services, and IT, to tell me what an RDAC is. And this is a snapshot of just some of them, but look at the diversity of the responses that I got. Some focused on who serves on the RDAC, the stakeholders and those diverse voices. Some focused on what exactly it is that they do. They advise, they advocate, they recommend. Others focused on the reasons they exist. Particularly folks in our communications department. I think that makes a lot of sense, right? They're talking about elevating voices and improving care, and driving policy, right? NORD messaging. And then some focused on the structure of these bodies themselves. These are official government bodies of appointed members. Very interesting, or I find it might be a little interesting. When I approach lawmakers who are with the idea to create a council in their state for the first time, the way I tend to introduce what an RDAC is not by the who or the what that is that the council is. It's actually by the action that they do. I say these are recommendation issuing bodies. These are advisory bodies. So, and I think it's really interesting that diversity of perspectives that we have about what exactly are these rare disease advisory councils. I do think that in the policy world, definitions are very important. Um, and the definitions add clarity and make sure that we're all talking about the same thing so that when we're legislating, we're all talking and legislating about the same thing. But here in this case, I don't think that diversity is a problem. I think it reflects that RDACs are complex and multifaceted entities. Um, so that, if you all remember, last year, I invited you all to do some fun interaction with me. Get out your phones, open up a new tab on your screen. If you are not able to do that, your activity point is going to be in the chat here. But I would love for you to tell me all, what is your definition of an RDAC? And as you are all getting that ready to go, I'm going to bring on the screen here. So to get plugged into this, you're either going to you're going to plug in that www.menti.com and put in that number code right on the page, or you can simply open your phone's camera and hover it over that big QR code, and it should bring you right into our screen so that you can get ready to interact with the quiz today. And we'll hold here as folks join until a few more people come in. There's a counter at the bottom of the screen that I can see. If you're not able to join into this capacity, use the chat feature. I will be reading out the questions out loud so that you can then give a typed response in the chat. All right, we have people coming in. Let's see if we can get to 33, just like 33 to 35. Yeah, a few more people. Okay. So just like how I asked my NORD colleagues, how would you describe an RDAC? And so you should have a screen coming up right on your phone. You should have it, and you can type right in, and you can also put in multiple options. I think you can answer more than once. Advisory, voice, collaboration, advocacy, and dynamic, empowering. I love these. Structured, it's dynamic. Collaboration, state advocacy, yes, state advocacy, change maker. Ooh, I like that. Empowering. I think it's very interesting how we have advisory and advocate coming up as the main ones for so many people. And we're going to be diving into that today. All right. So, oh, a few more came in. All right. So I want you to keep this word cloud here at the top of mind as we all move forward through the rest of our time together today. But before we dive in too much further, I would love to kind of see where it is that you're all joining from. So next, you should be able to place a pin right on the state where you're joining. Um, some people get very specific. They're even kind of able to find the exact city, but you have to be very particular when you're with your poke on your screen there. Looks like, and I remember if you all remember this last year, we had so much participation from Michigan. So let's see if who our leading person state is this year. Um, Looks like it could be California. I love that we're seeing people coming in from states that don't have a council yet. And we're going to talk about the options that you have so that you can become part of the 78%. We've got Texas and Nebraska. We've got Arkansas. Looks like we have somebody from Vermont, which we've had really great efforts going in Vermont to get our bill through there. We have someone in Oregon. All right. So I think something that, no matter where you are joining from today, and no matter where you are in your RDAC journey, right? We saw on our map here, there are many states that have one of these councils. There are still a few states left that do not. So no matter where you are with that, let's go through a little bit of a quiz here and see just about how much you all know about RDAC infrastructure. This is actually kind of a lesson learned from last year's stakeholder webinar when we found that the majority of people who were joining the webinar actually already did have a good amount of baseline RDAC knowledge. So instead of using our time together to go over the basics of RDACs, we're going to dive in a little bit deeper to more of a 201 level instead of a 101 level. But let's make sure that we have the 101 level top of mind before we move into that. So question number 1, what year was the first RDAC established? 2020, which we all remember was a really great year, right? The COVID pandemic. We have 2015. We have 1995 and 2018. So what do we think? The very first RDAC ever. Actually gonna take a look in. Let me see here. Genius here, and I'm going to be checking the chat too. I know that some folks are not able to use the interactive feature, so some of the responses coming in the chat. RDAC is a resource, most importantly, rooted with accredited populations. I love that, Anne. Yes. Arizona, consultant Virginia is here. Hi. 2015 in New York in North Carolina. Okay, so I think we have enough answers on this one. The correct answer is 2015. The very first RDAC was created in North Carolina in 2015, so they are celebrating their 10-year anniversary. Unfortunately, there were no RDACs created in 1995. However, I think my family was happy to know that I was created in 1995. So we can go there. All right. So there's our correct answer, 2015.
Carolyn, I think you're kind of biased in saying that they were happy. I'm just saying.
All right.
But I digress. Go ahead with the next question.
The next question is, how many states have created an RDAC as of December 2025? 42, 12, 33, or 17? Let's keep an eye on the chat here. 42, we got some answers. All right, so 12's not a popular answer. Okay. A lot of us are liking 33. 2. A few more answers coming in. In the chat, we have 12. Pam Delancey says 33 in the chat. Okay, and I'm going to show our correct answer. Our correct answer is 33. As of December 2025, 33 states have created an RDAC, 32 of which are active at this time. And they are all at various stages of their life, but the majority of them are well past their implementation phase and actively meeting and issuing reports. And they need you to be part of their conversations and part of that dialogue. But we're going to make sure that you all know that how you can get plugged into that process. Next, what does the A in RDAC stand for? Alliance, advocacy, administrative, or advisory? A lot of answers came in very quickly on this one. I think we have a good amount of confidence with this question. Okay, so I will reveal in just a minute. All right. The correct answer is advisory, rare disease advisory councils. And this is a really important question that I want you all to keep on the top of your mind because that is what we're going to be talking about throughout the rest of our time together. We have a chat answer advisory. Yes, that is correct. Okay, so according to new research, and this is you have to guess a number. So what do you think this is going to be? According to new research, what percent of the top performing states on NORD's state report card, which means they got an A or a B, have RDACs? On a percent of 0 to 100. And this is your best guess. This hasn't been revealed yet, so you're guessing. 90%. I love that. Let's see. %. Answer in the chat. Okay, 85%. All right, let's try to get one more person. Your best guess. Okay. 70% of top performing states on NORD's state report card, which means an A or a B overall, have an RDAC. And that is controlling for the RDAC itself. We do grade states on whether or not it's a yes, no on whether or not that the state has an RDAC on NORD's state report card. So when we did the math to get to this, we actually removed the RDAC as a variable, which means that we weren't including that as one of its grades. So we have controlled for that variable. So even without the RDAC being counted for, being controlled for the RDAC, 70% of states are receiving an A or a B on the NORD report card, and they have RDACs. All right, so that is our last question. So we are going to come back together. You should see the PowerPoint now. I'm closing this. Sorry, all, you're getting me in real time here. So let's all remember the different ways that my NORD colleagues described RDACs, and then reflect back on the word cloud that we all did. This definition on screen is from NORD's one-pager on RDACs. It's often used as an advocacy tool. We bring it to lawmakers when we're introducing a bill for the first time to help them understand what it is. So I think that diversity, as we mentioned, is really real. RDACs operate in a complex policy space. They're officially part of government, but they don't govern. They shape policy, but they don't make policy, and they create change, but they do it indirectly. And I think when you're passionate about change and you see urgent needs in your community, the advisory model can feel really frustrating. But I really want to talk about how it's actually a little bit more powerful than you might think it is, which I think some of the data that we got into a little bit is also going to help reinforce. So let's dive into what being an advisory body actually means. A lot of people like do and do not lists. So this is kind of framed in that kind of way here. So what advisory means? It means that they are established by state government, typically through legislation. However, we have also seen a trend in recent years of these councils being created by governor action or through an appropriation only. Um, They are official bodies with formal mandates that they are required to fulfill by state law or through their executive action. So they are accountable through legislation and through official channels. They study issues, they gather evidence, and they make recommendations. Their recommendations are then sent directly to lawmakers, governors, and other state agencies and leadership at state agencies. And then the policymakers then decide whether and how to act on those recommendations. RDACs provide the roadmap, the evidence, and sometimes political cover for any action. What advisory does not mean, RDACs cannot pass laws. The legislature passes laws. RDACs cannot implement regulations, that is, state agencies that issue regulations. RDACs can't mandate that anyone act on their recommendations, and they cannot enforce compliance. And a few RDACs do have budgets, but they do not directly fund programs or services. The budgets are typically for reimbursing their members to get to the meetings. So why spend all of the time and the energy to establish an advisory body if it can't force any action? And that is because of what it can do. Advisory bodies provide legitimacy. They're an official government body. They're not just one Carolyn's opinion. They provide diversity. They bring together patients and providers, researchers, health plan officials, perspectives that may not otherwise align or may not otherwise end up in the same room all the time. They provide evidence. They can conduct surveys and hold hearings, which all of you can participate in. They can analyze data and they can document needs through their needs assessments and through their population surveys. As we mentioned before, it can provide it provides continuity, a persistent kind of across election cycles and across administrations, since the gold standard is that they are written into law. And they create a formal channel for the community to reach decision makers. So you should really be thinking of the RDACs as the bridge between lived experience and policy action. They don't build the policy themselves, but they create the conditions and the foundations for good policy to be built and to be built well. In the drug development space, I think something we hear about often are pathways and an approval pathway for a drug example. So what we can see here is an example of one of the many RDAC impact pathways. Right at the bottom left, we see that the community has identified a barrier to access in their particular state. Their state has an RDAC, so that community member goes to their RDAC meeting, to one of their public hearings, and shares it with the RDAC. The RDAC will then study the issue. They'll do further surveys and further hearings and data collection. The RDAC will issue a formal recommendation on how to specifically address that problem. And those recommendations are then sent directly to lawmakers in the state legislature and policymakers in state agencies. The policymakers are then armed with the evidence that they need and the roadmap that they need to act in the way that is really going to benefit everybody and address that problem. Then the policy changes. Sometimes it does take a little bit long, but ultimately the community benefits. And there is the question that we wanted to answer on this. And does that actually work? For 5 years, we have believed that yes, it does. But now we have the data to prove it. So we analyzed the NORD state report card data across all 50 states to answer one question. Do states with rare disease advisory councils actually perform better on rare disease policy? We found a lot, and I have 3 particular data points that I'm very excited to share with you all today. So here's what we found. Data point 1, approximately 70% of top performing states have RDACs, controlling for the RDAC itself. That means we have removed the grade given to the state for having an RDAC in the first place to remove it as a variable. And when doing that, we still see that having the RDAC does in fact create a situation where 70% of top performers, A and B states, do have one of these councils. And what you're looking at here on this chart is each bar shows what percentage of states in that grade category have established an RDAC. So of all of the states that received an overall grade of A on this year's upcoming report card, 67% of them have an RDAC in their state. All of the B performing grades overall, 68% of them have an RDAC. All of the C performers, it gets a little closer to 50-50. We see that 53% of those states have an RDAC. And then of all the states that received a D this year, it was exactly 50-50. So 50% of them had an RDAC and 50% of them did not. Data point 2. States with RDACs show statistically significant improvements in NORD state report card rare disease policies, even when controlling for the RDAC itself. So we removed the RDAC as one of those graded areas, and we found that states without RDACs, on average, received an overall grade of a C+ on the report card, which is about a 2.59 in a numeric GPA. States with RDACs received an overall B-, or a GPA of 2.74, which is an improvement of 0.15 points. This is a very slight improvement. However, it is an improvement. It is statistically significant, which means it's not happening by accident. And I know that I would really love to see a C+ on my personal report card. I would love to see a B- as opposed to a C+ on my own personal report card. So I think this is a really great win and worth celebrating at our 5-year mark. Finally, data point 3. 33 states have created an RDAC over the last, since 2015, giving 78% of Americans RDAC infrastructure in their state government. And look at that change that has happened over the last 5 years. We went from 9 states in 2020, covering 19% of Americans, to now 2025, where we have 33 states representing 78% of Americans. All of that growth happening over in just the short time of 5 years, and that is all thanks to all of you. And I feel that you should all be really, really proud of that. So here's what we know. State RDACs are official advisory bodies that create a space for collaboration, evidence building, and a sustained unified voice for the rare community. And that translates into measurable policy improvement. RDACs are advisory bodies. States with an RDAC show better policy outcomes. 70% of top performing states on NORD state report card have one of these councils. And 78% of Americans now have the benefit of RDAC infrastructure. So what does this look like on the ground? The newest members of the 78% include Montana, Arizona, and Rhode Island this year. Yay! So thank you very much to all of you who were part of those efforts, and especially thank you to our 2025 legislative champions. Each of these lawmakers carried the bill in their respective state governments to sponsor the RDAC legislation, which was ultimately signed into law. Representative Alma Hernandez out of the state of Arizona, Representative Paul Tuss from the Montana House of Representatives, and Senate President Valerie Lawson from the state of Rhode Island. And they each have well wishes for us today. We will start first with a video message from Representative Paul Tuss. Hi, everybody. Thank you so much for being part of our webinar so far. We've heard from Representative Alma Hernandez out of Arizona, and I am also very excited to share that we have Representative Paul Tuss joining us from Havre, Montana. Representative Tuss carried Montana's RDAC bill, which was signed into law, making Montana the second of 3 RDACs that joined the community this year. Representative Tuss, nice to see you. How are you?
Carol, it's great to be here with you. Thank you for this opportunity. It's still morning here, so good morning from Montana.
So I just kind of to jump right into it. I have a few questions. I would love to kind of find out, what motivated you to sponsor Montana's Rare Disease Advisory Council legislation this year?
Yeah, that's a great question. I've been involved with the ALS Association for over a decade, and that was really my motivation, my personal motivation to get involved in this to begin with, is that very unfortunately, ALS has touched our family in a significant way. My wife passed away from ALS 10 years ago, and also my mother passed away from ALS nearly 20 years ago. And in addition to that, my brother-in-law passed away from ALS. So unfortunately, rare diseases have impacted our family in a very significant way. And so I've been part of the advocacy community through the ALS Association for nearly 10 years.
Oh my gosh, thank you so much for sharing that. I'm really sorry to hear, the impact that has had. But I think that, the way that it's showed up for you and how you've been able to, carry this bill is just kind of, you're able to create something that helps you remember them for years to come, and that is going to stands the test of time, and that's their legacy too now.
No, it really is, and advocacy is important. And with every step of the legislative process, I had my wife and my mom and my brother-in-law in my mind when we were doing this. It's important as policymakers to know that what we do in the halls of the Capitol has a real and lasting impact on people's lives.
Absolutely. And the ALS Association has been really great partners to NORD in this Project RDAC work. They not only were our partner here in Montana, but they were also a partner for us out in Rhode Island, which was another bill, our 3rd bill that was signed into law this year. ALS Association is always such a great group to work with, and we are so lucky that they brought you to us.
They're a great partner.
Just as a state lawmaker, right? So, what is the value of having an advisory body like an RDAC? Like, why not just have advocates come directly to you with their ideas?
That's another great question. And I can remember in my testimony to the committee when I was presenting this bill to begin with, one of the lines that I used was, we don't know what we don't know, right? And so I don't think that there is a legislator in the country that's not sympathetic toward the challenges of folks that are dealing with rare diseases. But as policymakers, we don't know what we don't know. And so I think what this does is it creates in a very organized fashion a vehicle or a mechanism that as policymakers we can use, in our case in Montana, to help affect policy going forward that'll hopefully make life a little bit better and a little bit easier for not just folks with rare diseases, but their families, their caregivers, and the medical community as well. And so it formalizes what we really need to be doing in the halls of the legislature, in our case in Montana, and throughout the nation. I think it's important.
I remember when you gave your testimony and you did, explicitly say that. You said, we don't know what we don't know. So I assume, your vision for how this council will inform policy in the years ahead will be helping to deal with that exact sort of scenario, right? And identify the things that we don't know.
No, absolutely. I mean, whether it's taxation or healthcare or education or infrastructure or ADA accessibility, all of the things that we deal with as legislators, as policymakers, we have to think about how does this impact our constituents? How does this impact all of, in my case, Montanans and the folks in my district? But there's a lot of folks dealing with rare diseases out there. How is this going to impact their lives? How is this going to impact their families? So I'm really hopeful that this is going to have not just a positive impact, but a very broad impact on those folks dealing with these issues.
Yeah. So kind of, just as we celebrate 5 years of Project RDAC today, which is the vehicle that NORD uses to help proliferate these councils, and Montana's place in that movement, what would you like to say to your advocates, your constituents who helped make, this possible, and then to just the broader rare community?
First of all, thank you. This would not have reached the governor's desk. This would not have gotten over the finish line if we didn't have strong advocacy from those in the rare disease world, right? So I couldn't do this on my own, and frankly, I wouldn't do this on my own. So the first message for me is thank you, a hearty thank you to those that were standing behind me the entire way, both literally and figuratively, to get this across the finish line. It really does take a village, and in this case, those folks were instrumental in making sure that this happened here in Montana. The second message is never give up. There's a lot more to do, right? And we need to turn over every rock as we inquire about how, as policymakers, we can make life a little bit easier for those dealing with rare diseases. So thank you, and don't give up. We have a long way to go. And in partnership together, I think we can get there.
And I cannot wait to be there with you. Thank you so much, Representative Tuss. Thank you for the time. Safe travels this holiday season. Happy holidays. We have our NORD is celebrating. Thank you so much for being with us.
Thank you for being here, and thank you for allowing me to be with you today.
Of course. Okay, coming back together to have from that meta experience of watching myself with all of you. It was such a pleasure to be working with Representative Tuss in Montana this year. I have never had a legislative experience quite like the one out of Montana. That bill sailed through the legislature this year, and it was all thanks to all of the work that that all of the Montana-based residents put in on that, and our partners at ALS. I am very unfortunately passing along news. Representative Hernandez out of Arizona did have an urgent medical situation that she had to attend to this afternoon, and she called me before she was going into that appointment. She was very, very sad to say that she's not able to join us, but I did assure her that our community is a community that will give her the space that she needs to be able to take care of what she needs to take care of and get the care that she needs. And she wishes us the best. And we're going to find another time down the line where we'll be able to hear directly from her in the future. And then the other message we have is actually from Senator Valerie Lawson, who was elected the president of the Rhode Island State Senate. And she sent along a message for me to give you all, which is that she wishes us the very, very best meeting and was so over the moon to finally be able to carry an RDAC bill for the great state of Rhode Island and see the smallest state join the RDAC community. And so those are our well wishes from our lawmakers for today. What we're going to be moving into next, we now have individuals from active meeting rare disease advisory councils throughout the country. We have guests from Mississippi and Missouri able to join us for today. So the first individual I'd like to introduce you all to is Aaron Blocker. Aaron is the chair of the Mississippi Rare Disease Advisory Council, which was established in 2024. So this is one of our newest councils that just got up and running, and they really hit the ground running. And so the Mississippi Council is housed out of the University of Mississippi Medical Center. And Aaron is going to tell us about this groundbreaking first year. Hi, Aaron. Nice to see you.
Hey, good to see you again too. Thanks for
Yeah,
having me.
of course.
So, as Carolyn said, my name is Aaron Blocker. I'm the chair and executive director of Mississippi's Rare Disease Advisory Council. I'm also a rare disease patient, so that is one big reason why I was involved in this and had been pushing for Mississippi to put an RDAC in place for several years as well. And then just from just a professional background, I have a background in public health policy, and I work as a director of patient access for rare bleeding disorders. So, as Carolyn said, our RDAC was signed into law in 2024, and it was kind of a bit of a whirlwind. We didn't expect it to get signed or to happen, and it did. It was just kind of like all of a sudden the bill came through and it got out of the legislator, and they got it signed. So we were really excited. So it was signed in the middle of I think it was like April of 2024, with a deadline to get kind of a board of directors established really by I think around October-ish. And then we as an RDAC were officially established as the council around December of 2024 is when the council really came together. But truthfully, January of this year is finally when we were able to have really our good first meeting. We got me in place as the executive director of the council, and really just honestly tried to hit the ground running. We do have a board of directors that is part of kind of our overall RDAC that has the state insurance commissioner. It has the health department on it. It has a researcher. So it's an overall board that gives us access to a lot of different state bodies, so that we are able to kind of pull from them. And we really, there were several things in our actual RDAC bill that they wanted us to do within our first year. One of those was to do like a needs assessment or like a rare disease kind of landscape to really get a picture of what rare diseases are affecting our state. And so we had about 6 months to do it, which was really, it was challenging, but we did make it work. We partnered with our health department and with Mississippi's only genetic clinic at the University of Mississippi Medical Center to get some data around what rare diseases were they seeing? You know, what are we seeing on our newborn screening? What is coming through potentially the health department, and what are some of those diseases that our only genetics clinic is really seeing and working on primarily? And so we were able to do that. We did a good report on it, and we were able to identify some high level diseases that seemed to be kind of a common in Mississippi. And so our next focus we want to add data points and expand that in 2026. And so we want to continue to kind of dive in on what are these diseases, what may be missing, and what can we as a Rare Disease Advisory Council do to help them, and work with our legislators to hopefully get some potential policy passed for rare. And one of the really interesting things that happened this year is that our state legislator actually passed a bill requiring us as the RDAC to do a study on alternative funding programs for rare diseases. And so that was something that we had also about 6 months to do, which was a bit of a challenge, but we did get it submitted. But it does show that even within our first year, the legislator is already reaching out to us and seeing us kind of as a resource and a partner, and figuring out some of these things that are impacting our rare disease community. And that's really what we want from an advisory relationship. You know, we want these legislators and lawmakers to kind of realize that the council can provide really good, valuable input on some of these complex issues that are affecting rare patients. And so we're hoping that if we see, that they've seen our value early, that we can continue to build on that and partner with them. So we want to make sure that next time for something like a study or a policy question that they pull us in first, that we're in the conversation even earlier, so that we can hopefully get some of those questions asked, how they want them, what questions they're thinking about asking, and really not just kind of answer them after the fact. But again, it does just go to show that they're already kind of using us and reaching out to us to advise them on rare disease policy and things that are affecting the community. And one of the other things that we've tried to do this year is to really build those legislative relationships with our state legislators. And so we wanted to be a little proactive about it. And we started meeting with some of our state legislators. So myself and a board member, we met with a couple of our state legislators this year in person, as well as, doing some email communication to those that we couldn't get a meeting with in person. But we want to ask them, what are they working on in the rare? What do they want from us as an advisory council as we progress forward? There were a few things that were, legislated for us to do. We had a couple of mandates really that we needed to do in that original RDAC bill. But outside of that, what else are they looking for from the advisory council? How can we best partner together? What questions do they have about rare diseases in the state? And how can we, be most helpful? And I think we had a really good positive response. We had some good meetings, and we're working to keep kind of an open line of communication with them. And then one other thing that was really cool that happened is we actually had our United States Senator Roger Wicker's office reached out to us personally. They wanted to set a meeting up with us. We didn't reach out to them. They actually came to us, and he's very interested in rare disease work and policy work. And they knew of the RDAC had been passed and started, so they reached out and wanted to know how could they get involved and how could we partner with them, even from the United States representative aspect of this, not even just our local state legislators. So we've had a little bit of buy-in from even our federal legislators, which is really cool. And we've had a couple of follow-ups with them as well. And we're getting some really good feedback and more meeting requests. So what we are trying to do is really just build a good foundation for the RDAC. And our first year has really just been trying to get our feet under us, build a little bit of credibility within our state legislator, our government. And I think that's a really good priority for year one. And so I feel like we've done a couple of other things. We also had to create a rare disease resource list, and that is actually posted on our several of our state websites. So we've created a bunch of resources that rare disease patients can go to, and it's on like the Department of Health website and a couple of others. And so we've been able to do things like that too in terms of providing some resources. So it's been a really good first year. We've done our best to hit the ground running and do as much as we kind of can. We do want to continue to advise and work with our state legislators, while also within our second year working on doing some really outreach to our community and getting more involved in the rare community in Mississippi. So it's been a really fun year for rare here in Mississippi, and I'm looking forward to continuing that. And we know that this year has been a bit crazy of a policy year. And so, we just in general, it's been a tough year. And so we are working with that, and the RDAC is hopefully working, we want to be a resource for rare patients in our state. And so we want to help kind of blunt some of the policy stuff that comes down the line. So we're hoping, in the years ahead that we can continue to be an impactful advisory body to our state legislators and continue to advocate for those in Mississippi. So, yeah.
Thank you so much, Aaron. Congratulations on an incredibly impactful first year. I think you said it right, that that foundational work that you were doing this first year was definitely the right priority for year one. Having a foundational relationship with your officials in government is key before you you have to start reaching out with asks on them, right? You got to get to know the person behind the policy. And I think the work that you were doing was feeding directly into that. So congratulations on your first year. It's amazing.
Thank you. Thank you.
Next up, I am very excited to have with us Dr. Matt McLaughlin, who is a member of the Missouri Advisory Council on Rare Diseases and Personalized Medicine. The Missouri RDAC was established in 2018 and is housed uniquely. There are two other councils with the same kind of housing structure, but the Missouri RDAC is actually housed within the Medicaid program. And Dr. McLaughlin is with us to tell us a little bit about how that looks in practice. Hi,
Yeah,
Dr.
well, obviously, thank you, Carolyn. My name is Matt McLaughlin. I'm a pediatric rehabilitation medicine physician in Kansas City, Missouri, and also have advanced training in clinical pharmacology, and was invited to be on our RDAC, which is founded in 2017, or at least legally founded in 2017, and we started having meetings in 2018, and I've been a member since that time. Interestingly, as Carolyn mentioned, our RDAC is housed within the state Medicaid program, and so we have a very unique relationship, I think, with the payers in the state of Missouri, especially obviously when it comes to advising the most appropriate patients to get some of these medications as quickly as possible. And I wanted to share a real quick story about how that RDAC in Missouri really helped address a critical medication access issue to get patients a medication faster that is beneficial. And it really shows, I think, what advisory councils can do when they bring the right experts together with the right decision makers and payers in one room. And this involves a medication called Zolgensma, which is a medication we prescribe, which is a gene therapy for children with spinal muscular atrophy that's been on the market now since 2019. And our state Medicaid system was taking a pretty significant amount of time to approve Zolgensma. And obviously so. It initially cost at that time $2.125 million per dose, right? And in the meantime, we knew that other cheaper medications were getting approved quite quickly. And I guess comically, when I say the word cheaper, I mean drugs that cost $75,000 per dose instead of $125 million per dose. So these kids weren't really getting the optimal medication as fast as possible because they were waiting for this whole Zolgensma process to be approved to be completed. But here's the thing about Zolgensma and a lot of other gene therapies is that we know when we give these medications earlier, for instance, like in the case of Zolgensma, earlier is better for these kids, and it may prevent them from being in a wheelchair or needing a wheelchair in the future. It may prevent them from needing a ventilator or any other extensive kind of medical equipment. So, as we like to say in treating these neuromuscular conditions, time is nerve. And so, if we're waiting to treat this condition, we have lost nerve, and that is nerve that we cannot get back. And so, it's very important for us and from a system that has a perspective like Medicaid, which controls both the pharmacy spend and the durable medical equipment like wheelchairs or ventilators or things like that, that those expensive medications can actually really be budget relieving to the entire state if it prevents some of those downstream costs. And I think that's a very important thing that we never think about nor talk about when it comes to treatment of rare diseases is our ability to help control some of those downstream costs for a payment system. So as I said, our RDAC is really housed within Medicaid. So they're very aware of our expertise kind of in this specific area. And as RDAC members who specialized in treating these neuromuscular conditions like spinal muscular atrophy, we set up a phone call with the Medicaid decision makers. And we asked the question, why is it taking this a significant amount of time for this one medication to get approved when in reality it is a gene therapy that has had significant benefit on this condition? And I think there was really a value in having myself as an RDAC member with a knowledge of the specialties involved in treating this condition, involved in brokering kind of this discussion. It allowed me to bring in additional experts, including my own director at the time, to have conversations with the right people in the right room. And then through this conversation, we were really able to help the Medicaid system understand that the medication we want to get to, regardless of what it was, is best given if that's the medication is given first, right? And that helps them from a financial perspective of not giving additional medications. It helps the patient for getting the right medication as fast as possible. So the goal really became, how can we expedite this review of a Zolgensma medication to be as fast as possible so we can avoid using any other interim medications and increasing the cost of what it costs to treat these kids. So now we're getting kids with Zolgensma, this medication, within the first 2 to 3 months of life compared to a longer time of waiting for the approvals to happen. And that's a huge difference for us in our outcomes. And we don't have when we don't have medications approved in this timely way, we're literally losing time with patients whose conditions are actually predictably getting worse. and getting that approval process expedited really meant better outcomes for kids. And so what we did as an RDAC was really bring together the clinical expertise and the administrative decision makers to have an informed conversation. And this helped identify the problem, explain why it specifically mattered, both from a clinical and from a financial perspective, and we helped them see a better path forward. And so a lot of times I feel like families feel that kids who have a rare disease are at odds with the payers, when in all honesty, I think the payers ultimately want what's best for the kids as well, and finding ways to get both in the room at the same time, and aligning the conversation in a way that can be both a win-win for both the payer and for the patient is really kind of a goal of something that an RDAC can do. And so for me as an individual who cares about the kid who cares clinically for these kids with disabilities and obviously personally for kids with disabilities, this was a huge win, I think, for me. And I always value treating one patient at one time. That's why I went into medicine, right? But through the power of an RDAC, you can treat thousands of patients with rare diseases with one decision or one piece of advocacy. And so for me, that was the true value of being able to be on an RDAC member, is that we really can help change how thousands of kids in the future in my state get treated.
Matt, that is absolutely incredible. Thank you so much for sharing that story with us. Thank you for getting all of the right people together in the right room. Something that sticks out to me as a huge value add. I imagine an issue like that could have reached NORD, right? Somebody would have reached out to us and said, this is happening in my state. And then, of course, we at NORD would activate and pull all the people together to have that gathering. But with the RDAC already in place, that infrastructure was already there. And we were able to fast track the action that was needed to be able to make this coverage issue get resolved, and preserve nerve, right?
Right.
So thank you so much for joining us today. Thank you so much
Of course, Carolyn.
for all that you're doing.
Thanks for the time for that. I appreciate it.
Of course. Our final story today comes out of the great state of Tennessee, which, like Missouri, is actually also housed within the state Medicaid program. But this is a really fun awareness building story, right? I think often in the rare disease community, a lot of us spend that whole first portion of most conversations with the primer of what a rare disease is in the first place. So if we can have a foundation of awareness already built up, that means that we can enter into the state and really get into the deeper nitty-gritty conversations that are required to make policy change happen. And the Tennessee Rare Disease Advisory Council realized that. They identified a lack of awareness in their community as a barrier to diagnosis and support. And so they decided to capitalize on one of the best days of the year, Rare Disease Day, and developed a strategy for a visibility campaign. And they did the work that was needed to collaborate with stakeholders, including us at NORD, as well as local billboard vendors within Tennessee that RDAC members were actually connected with. And they were able to secure the resources necessary to have a series of Rare Disease Day billboards go live in downtown Nashville, Tennessee on Rare Disease Day last year, 2025, this past year, 2025. So this is statewide visibility, raising awareness about rare diseases, of the diagnostic odyssey and available resources in one of the greatest tourist destinations of all time. And it really just kind of demonstrates that advisory councils aren't just advising on legislation. They're not helping all the time with coverage decisions or meeting with lawmakers, but they're also identifying creative ways to address community needs and build the awareness necessary for future policy success. So this is kind of like just looking at the range of what we have here. Tennessee raised awareness through a billboard campaign. Missouri influenced agency coverage decisions with data and recommendations and convening the right people. And Mississippi hit the ground running, establishing those key foundational relationships with their federal lawmakers and their state lawmakers. These are all advisory bodies, and none of them can mandate the change, but they are creating change. And this is the RDAC effect in action. It looks different in every state, but it's always about creating the right conditions for change that our community really relies on. So we're going to start to come into the period where we're winding down on our program and our time together today. And we're going to do that by giving you all a little bit of a window into what is ahead for NORD State and for Project RDAC in 2026. So as Pam mentioned at the start of our program today, we are going to continue to see RDACs be added to the community. We got to get up from 78% of Americans to 100% of Americans. So our 2026 areas of focus include New York, Vermont, and getting some money to get California's council actually up and running. And then doing some supportive work in Michigan. There is a really great effort being led in Michigan that NORD is very, very happy to be supporting and being a part of. I often make the joke that I have had a hand in creating New York's Rare Disease Advisory Council 4 times. Before I came to NORD, I was working at the New York State Senate, and the RDAC bill was one of the first bills I was ever assigned to analyze and shepherd through that process and then see extended in my 3rd of 5 budgets. And now I'm at NORD seeking to make it permanent. So let's say 4th time is the charm, and this will be the year that we can do that. What Pam was talking about earlier as well was how we want to see these councils survive and thrive. And that comes out of what we have kind of found to be a warning shot. Just this past budget cycle out of the state of Ohio, we actually did see Ohio's RDAC eliminated in their latest budget bill. And that was amid broader efforts surrounding government efficiency type issues. So reducing the size, scope, and spending of government. We were able to activate our community and we were able to secure an administrative stand-up of that council, which will go through the term of Governor DeWine. But we are going to have to do the work necessary to make sure that we can bring it back up to gold standard legislative status. And part of that work is what's going to be wrapped into those efforts to help existing councils survive through periods like that, and not just survive through periods like that, but really meet their greatest potential and operate at peak capacity. What we're also going to be looking at doing is state Medicaid regulatory engagement work. As you all know, there was a pretty key piece of federal legislation that was signed into law this summer, which creates a whole set of mandates for states to start to get implementing that are going to have very real impacts on patient access to care. And many of those decisions, the implementation of that law, is actually not going to be played out in your state legislatures. A lot of it will, but a lot of it is actually also going to be happening inside the walls of state health departments, state Medicaid programs, and state insurance agencies. So this is the regulatory level, where really to date, the state regulatory level, the rare disease perspective hasn't really been inserted quite yet. But NORD is meeting the moment there, and we are preparing for 2026 to make our entry into the state regulatory space for the very first time. And I'm very excited to see about all the great work that is going to be able to come. And then finally, we've been talking about this tool a little bit, but NORD's state report card activation. NORD has had a state report card where we have graded states across 9 different policy areas for the last 10 years. And we're starting to look at how can we transform that from something that we all read into something that we all use to drive measurable policy improvements. And that is due to be launching January, the second full week of January 2026. This will be your state-by-state guide to rare disease policy. You can see your state's overall grade. You can compare it across 9 different policy areas and download the complete data sets that go into what policies are even making up that grade in the first place. and then use it to inform your advocacy in 2026. I don't want to leave you all without the resources on how to get more plugged into everything that we're talking about here. So, some of the key ways to get involved. Marking your calendar. You have to save the date for the launch of the NORD State Report Card, which is that full first week of January 2026. Why that date? The majority of state sessions will be starting that full first week of January. So this is a really great tool to have in your hand to then bring to your state lawmaker and say, are you ready to get to work? Here's our report card. Here are the areas where we should work together for the year ahead. We're going to be doing that, and you're going to be able to do it as well. So mark your calendar, and we're going to be diving into the data a little bit as well in a future webinar series later in the year. You should also be joining NORD's Rare Action Network. You can do that by emailing action@rarediseases.org or simply going to rareaction.org. Our Rare Action Network is our state-based zone for all things advocacy. You get all of our alerts, you get all of our resources, and you are connected to the community of advocates that are just as fired up as you are and ready to make some change happen. You should also be engaging with your state council. So all of these rare disease advisory councils are public bodies. They are official government bodies. And the way that our government system works best is that it's bidirectional. We feed it through our participation with it, which means that you need to be reaching out to your council so that they can reach out to you and vice versa. Attend your council's meetings, send them in public comments so that they have actual input from all of you in the community to then drive what they're going to be working on for the year ahead. The best way to do that is to email me, RDAC@rarediseases.org, for information on your specific council. Or you can simply use Google or your favorite search engine. I like to use DuckDuckGo. And type in Rare Disease Advisory Council and then your state after that. And it should come up right at the top. And then finally, the best way to get involved will be to prepare your stripes. Rare Disease Day 2026 falls on the 28th of February 2026. If you go to rarediseaseday.us, that is the microsite that NORD hosts for Rare Disease Day, and it has all things that you need. It has cool swag. It's got the lights that you need to light up for Rare. It'll have all of the events that are happening throughout the country. And you can find one that's happening near you, or you could start one yourself and then submit the event to the calendar to have more folks join your event. All right, and with that, coming into, does anybody have any questions for me? Because I have one more final question for all of you.
So Carolyn, before you ask the question, I just want to let the folks who submitted comments to let them know that we will be following up with them. Just because in case that wasn't clear, we're keeping them. We weren't responding to them in the webinar, but we do have some folks who wanted to understand, how do they get involved or how do they establish an RDAC in their state, et cetera, et cetera, et cetera. So we will follow up with everyone. Just no worries there.
Yes, absolutely. Yep. All right. So if you grab your phone one more time, you should see the latest closing question for us. Where do you want to see your state RDAC going in the next 5 years? We have get involved with housing issues for those with developmental disabilities. Interesting. Yes. Yes. Housing is such a critical social determinant of health. I want there to be one formed in Texas. I'm with you. Yes. So the Texas legislature does not meet in even years. They meet only in odd years. So we're going to have to pick up legislative efforts for Texas in 2028. Yes, I love that. All 50 states. Let's get to 100%. All right. And I'll keep this up emphasizing minorities' health needs. Yes, absolutely. When you help, helps everybody. I want to see Ohio moving forward. We need the RDAC. Thank you for the mention, of course. Yes, thank you for being here today. Strong establishment within the first year in Arizona, community engagement and collaboration. Yep. And I am very excited to say Arizona's administrators, so while they were only just signed into law a few months ago, we did have folks from Arizona join us at our in-person gathering. So they are on a really great track for early success, having already met all of those fellow rare disease advisory councils that will hopefully really help them get started up and running at a level of Mississippi. Okay. And what we will do next. Oop. We get back to, so we're going to close out. So 5 years ago, we launched Project RDAC, believing that these councils would strengthen rare disease policy. And today, we don't just believe it, but we can prove it. The RDAC effect is real and it's measurable, and it's transforming how states serve their rare disease communities. I want to give my sincere thanks to our project supporters, Acadia, Amgen, CVS Health, Genentech, Merck, Pfizer, Takeda, UCB, Ultragenyx, and Vertex. And I want to thank everybody in this community. Thank you for being part of our movement. Here is to the next 5 years and to reaching 100% of Americans living in states with rare disease advisory council infrastructure. Thank you so much. Yay.
Happy holidays, everyone. Be safe, be healthy. Peace.
Yep. Bye, everybody.